Nurse Aide Test Prep Book PDF. Question 1. Normal oral temperature range is: Option A, 96.0 to 97.5 degrees Fahrenheit. Option B, 97.6 to 99.6 degrees Fahrenheit. Option C, 98.6 to 100.6 degrees Fahrenheit. Option D, 99.6 to 101.6 degrees Fahrenheit. The correct answer is option B, 97.6 to 99.6 degrees Fahrenheit. Normal oral temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, average 98.6 degrees Fahrenheit. 96.0 to 97.5 degrees Fahrenheit is below normal, hypothermia. 98.6 to 100.6 degrees Fahrenheit includes normal and low-grade fever. 99.6 to 101.6 degrees Fahrenheit indicates fever requiring reporting. Question 2. The chain of infection includes: Option A, pathogen, host, transmission route. Option B, air, water, food. Option C, bacteria, viruses, fungi. Option D, skin, blood, mucous membranes. The correct answer is option A, pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example, hand hygiene breaks the mode of transmission. Question 3. The nurse aide is caring for a client who speaks a different language. The best approach is to: Option A, use hand gestures and hope the client understands. Option B, speak loudly and slowly. Option C, use a trained medical interpreter. Option D, ask another client to translate. The correct answer is option C, use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 4. What is the most important action a nurse aide can take to prevent the spread of infection? Option A, wearing gloves at all times. Option B, performing hand hygiene. Option C, wearing a mask. Option D, isolating all clients. The correct answer is option B, performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 5. When measuring blood pressure, the nurse aide should place the stethoscope over which artery? Option A, radial artery. Option B, brachial artery. Option C, carotid artery. Option D, femoral artery. The correct answer is option B, brachial artery. The brachial artery, located in the antecubital fossa, inner elbow, is the site for auscultating Korokov sounds. The radial artery is used for pulse counts. The carotid and femoral arteries are not used for routine blood pressure. Question 6. How long should a nurse aide rub hands together with soap and water during hand washing? Option A, 10 to 15 seconds. Option B, at least 20 seconds. Option C, 30 to 40 seconds. Option D, 1 minute. The correct answer is option B, at least 20 seconds. According to CDC guidelines, hand washing requires at least 20 seconds of vigorous rubbing to remove transient microorganisms. 10 to 15 seconds is insufficient. A full minute is not required for standard hand washing. Question 7. What is the correct position for a client receiving oral care to prevent aspiration? Option A, supine position. Option B, Fowler's position. Option C, prone position. Option D, Sims position. The correct answer is option B, Fowler's position. Fowler's position, semi-sitting, prevents aspiration by allowing gravity to aid swallowing. Supine, flat, increases aspiration risk. Prone is not appropriate for oral care. Sims is used for enemas and rectal procedures. Question 8. The compression to ventilation ratio for adult CPR, single rescuer, is option A 15:2, option B 30:2, option C 5:1, option D 10:1. The correct answer is option B, 30:2. For adult CPR by a single rescuer, the ratio is 30 compressions to 2 breaths. This is the American Heart Association standard for effective CPR with minimal interruption. Question 9. An adult client with a respiratory rate of 8 breaths per minute is experiencing option A tachypnea, option B bradypnea, option C normal breathing, option D hyperventilation. The correct answer is option B, bradypnea. Bradypnea is an abnormally slow respiratory rate below 12 breaths per minute in adults. 8 breaths per minute is significantly below normal. This may indicate respiratory depression, sedation, or neurological impairment and requires reporting. Question 10. The proper body mechanics for lifting includes option A, lifting with the back, option B, lifting with the legs, option C, twisting while lifting, option D, lifting with arms extended. The correct answer is option B, lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 11. What is the correct order for putting on personal protective equipment, PPE? Option A, gloves, gown, mask, goggles. Option B, gown, mask, goggles, gloves. Option C, mask, gloves, gown, goggles. Option D, goggles, gloves, mask, gown. The correct answer is option B, gown, mask, goggles, gloves. The correct sequence is gown first, then mask, goggles/face shield, and gloves last. Gloves are most likely to become contaminated and are removed first during doffing. Question 12. A client who is withdrawn and refuses to speak to anyone is likely experiencing option A, depression, option B, anger, option C, excitement, option D, anxiety. The correct answer is option A, depression. Withdrawal and refusal to communicate are common signs of depression in the elderly and chronically ill. While anxiety and anger may include withdrawal with silence more strongly suggests depression. Question 13. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should option A, ignore the difference, option B, recheck it after 1 to 2 minutes, option C, change the client's medication, option D, document the first reading only. The correct answer is option B, recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 14. A client who is agitated and wandering should be option A, restrained to ensure safety, option B, redirected calmly to a safe area, option C, left alone to tire out, option D, given medication to calm down. The correct answer is option B, redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 15. When is alcohol-based hand rub acceptable instead of soap and water? Option A, when hands are visibly soiled. Option B, after using the restroom. Option C, before touching a client with clean hands. Option D, after caring for a client with C. diff. The correct answer is option C, before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 16. Which of the following can cause an inaccurate pulse oximetry reading? Option A, nail polish. Option B, client holding their breath. Option C, client sleeping. Option D, client sitting up. The correct answer is option A, nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 17. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B, weigh the client at the same time each day. Weighing at the same time each day, example before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 18. The nurse aide should report which finding as a possible sign of abuse. Option A, bruises at different stages of healing. Option B, bruises on the shins. Option C, a client who is hard of hearing. Option D, a client with memory loss. The correct answer is option A, bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 19. A dying client is breathing irregularly. The nurse aide should: Option A, call the nurse immediately. Option B, continue to provide comfort care. Option C, administer oxygen. Option D, start CPR. The correct answer is option B, continue to provide comfort care. Irregular breathing, Cheyne-Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status, do not resuscitate. Question 20. Which approach is best for a client with dementia who becomes agitated during personal care? Option A, use a firm tone to assert authority. Option B, provide simple explanations and allow choices when possible. Option C, complete care quickly regardless of the client's response. Option D, skip the care altogether. The correct answer is option B, provide simple explanations and allow choices when possible. Simple explanations and offering choices, example, would you like to wash your face first or your hands, reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 21. A client with dementia becomes aggressive. The nurse aide should: Option A, restrain the client immediately. Option B, remove themselves from the situation and seek help. Option C, yell at the client to stop. Option D, ignore the behavior. The correct answer is option B, remove themselves from the situation and seek help. Aggressive behavior in dementia may indicate unmet needs or pain. The aide should ensure safety, step back, and seek help. Restraint requires an order. Yelling escalates behavior. Ignoring is unsafe. Question 22. How should the nurse aide shave a client who takes blood thinners? Option A, with a straight razor. Option B, with an electric razor. Option C, with a safety razor. Option D, the same as any other client. The correct answer is option B, with an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 23. A client's oxygen saturation reading on the pulse oximeter is 95%. This is: Option A, below normal. Option B, normal. Option C, above normal. Option D, requires immediate reporting. The correct answer is option B, normal. Normal SpO2 is 95 to 100%. A reading of 95% is at the lower end of normal but is acceptable. Readings below 90% require immediate reporting. Question 24. A client becomes upset and tearful while discussing their recent diagnosis. The nurse aide should: Option A, change the subject to something more positive. Option B, tell the client to stop crying. Option C, sit with the client and allow them to express their feelings. Option D, leave the room to give the client privacy. The correct answer is option C. Sit with the client and allow them to express their feelings. Allowing the client to express emotions and providing a supportive presence validates their feelings and helps them process difficult information. Changing the subject dismisses their feelings. Telling them to stop crying is insensitive. Question 25. A client with dementia has incontinence. The nurse aide should: Option A, place the client in adult briefs without offering toileting. Option B, offer toileting at regular intervals. Option C, restrict fluids to reduce incontinence. Option D, ignore the issue. The correct answer is option B. Offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting.